So I'm MarisaFlores. I'm a PsyD student from Azusa Pacific University, and I'm also interning at Spokane VA. So today I'll go ahead and be talking about the impact of ambiguous loss on couples with a partner affected by a traumatic brain injury, and this is a critical literature analysis. So it's kind of just to begin, just being able to talk about what a traumatic brain injury is, and it is by external force. So this is any kind of change in brain functioning or any other evidence of brain pathology. To put it into perspective, approximately 2.8 million people in the United States actually sustain a TBI each year. So that's actually more than people diagnosed with breast cancer, multiple sclerosis, spinal cord injury, and HIV and AIDS all combined. So that's definitely one of the reasons why I wanted to focus on traumatic brain injuries. And so the most common impacts are just physical limitations, depending on if there's an accident causing the TBI, cognitive functioning, so memory, processing speed, executive functioning, psychological distress, definitely relationships, which I'll be focusing on today, and then employment and community reintegration after. As far as marital instability, this is very common within TBIs, and some of the predictors that were found were younger age, being a male, and the victims of violent injuries, so such as like assault or something similar to that, and also moderate injury severity. So the theory of ambiguous loss, most people haven't heard too much on this, and this was developed by Pauline in the 1970s, and it just explained the unclear loss of a loved one. So there are two different types of ambiguous loss. So the first one being the loss of an individual's physical presence, so such as a missing person or a military deployment. And then type 2 is the physical presence, but psychological absence. So that's more with the TBI. So I'll be focusing on type 2 for ambiguous loss. So really, it just makes it really difficult for patients to process grief, depending on this isn't as clear as a person that was lost. They're still there, but psychologically, it's a lot more difficult. So obviously, it puts the stress not only on the patient, but also on the couple in general. And so why I really focus on this is that when I was looking through literature, there was a lot of emphasis on relational stability and satisfaction for TBI and their partner after, but there was nothing on ambiguous loss. There isn't too much information. So I wanted to be able to do this study and to have a response to the needs of the people living with the TBI, but also the significant other, and be able to kind of establish some more long-term resources for both. So with that being said, I did use PsycInfo, Google Scholar, and PubMed, and those are the search items listed. So I focus on just specifically qualitative studies, and the purpose of that is that I got a lot of information and data from just being able to read on different experiences that either the patient had, the partner had, or both the caregiver and partner. So I got different interviews for kind of each. So these are the main themes, which I'll talk about in the next slide. And the number listed next to it is how many of those articles kind of related and had those major themes pop up. So some of these common themes are just the roles in the relationship change. So there's definitely this assumption that the spouse, that this will only be a short-term solution for the spouse and they just need to adjust for short-term. But reality is typically the spouse becomes a caregiver just because how abrupt this typically occurs. And also there becomes almost like this parent and child relationship instead of this couple relationship. So self-identity and partner identity. So the person with the TBI really has difficulty with now their core characteristics of just being a person are kind of taken away based on, you know, cognitively how they are, physically, but also the partner also has difficulty because most of them during the qualitative studies said something about having this hope that they'll get the person that they had before, which almost causes difficulty within what their relationship looks like. So as you could imagine, ambivalence comes up in psychological distress. Having to hold that dialect between hope and despair becomes difficult. So with guilt, some of them, actually most of them, either made some type of past tense reference to their loved one, even though they're alive. Some said that they'd be better off dead, just given just this ambiguity that they're having and compassion fatigue. Some of the frustration really lied in invalidating information from others, kind of those individuals telling them that, you know, they're fortunate for their spouse to be alive, when in reality it just invalidated their feelings for the difficulty of it. And then intimacy and connectivity were actually the most profound ambiguous loss as a couple altogether. So future planning, that becomes difficult as well. Now there's so much uncertainty what the future holds, and just really change their quality of life of the relationship. So one of the biggest treatments is resiliency, and really focusing on resiliency. So being able to understand, you know, what are those things that they're able to grow from, and what are the outlooks and support that they can see as their personal resilience. But also there were some that talked about, you know, them having moral growth after this, because they're understanding what makes them happy now versus maybe materialistic things or things that they thought that were important before. It put them in a different perspective. Also just being able to kind of almost do this identity reconstruction and figure out what things in their life are really helpful in their recovery process. So other treatments are really just those therapy interventions, so incorporating resiliency in that, but also giving spousal resources and being able to give them resources before, during, and after, as far as rehabilitation for the person with the TBI, and also providing them with some resources as well. So altogether, just being able to understand that because of advancing technology, TBI cases are really becoming more common in society. So, but there's so much less understanding of the impact on their relationships. So from a systemic point of view, really understanding how that affects both of them, person with TBI and their spouse. So hopefully this sets up for some future research and resources for the couple altogether. And that is it. I'll go ahead. Trying to jump back into here.
Okay, great. Thank you so much, Marisa. Does anyone have any questions, comments?
Yeah, one thing I was curious about, Marisa, is I sometimes actually think that healthcare providers, hopefully not psychologists, can contribute to the ambiguity, right? I'm thinking of folks who, you know, just medical professionals. I think sometimes they don't have the training to say, yeah, like this person's recovery is going to be permanently limited to whatever ceiling, right? And if the person's not hearing that clearly, then they can. Was that something that comes up at? Has that been looked at in this literature, right? Like, does ambiguity relate to the quality of messages people are receiving from care providers?
Yeah, that was actually something that I discussed in my dissertation, is really just that a lot of people with TBIs actually feel like they're almost stigmatized and put into this bubble that they all are similar and have similar difficulties. So that actually kind of added to this difficulty understanding what their identity is, which in turn didn't really help with the recovery process. So having the healthcare workers kind of understand too what ambiguous loss is and what they're dealing with would be extremely helpful, and kind of helping our work as well.
Right. Sounds like a good role for psychologists.
Yeah.